Hello guys, Assalamu alaikum. Welcome to Revised Pathology. Today we are here to discuss on the topic that is cellular adaptations or adaptive disorders of cells. Definitely. Now, let's see what are the cellular adaptations or what are their adaptation disorders. What does it really mean and how many types are there? Okay. So basically, these are the disorders in which the cell does an adjustment once it comes under some pathological or physiological stress. Okay, so what is here? It is basically a disorder in which the cell adjustment occurs due to a physiological or a pathological stress. Now, we are going to see that how many types of cellular adaptations are there. Number one is atrophy. What is atrophy now? Atrophy is decrease in size and number of parenchyma cells of an organ. So what is it basically? Decrease in the size and decrease in number, fine, of the parenchyma cells of an organ. Okay. Now let's come to the causes. We will see the physiological causes. The first physiological cause is, or an example we can say, is atrophy of thymus in adult life. Fine. First, the atrophy. What is first example is atrophy of thymus in adult life. The second is atrophy of lymphoid tissue with age. Okay. Now let's come to the pathological cause. So, guys, once we come to the pathological causes, there are different types of atrophy, pathological causes, and once it comes to the pathology from the name itself, that means there is a pathological aspect to it. Fine. So, the first one comes starvation atrophy. Obviously, from the name itself, the atrophy occurs due to starvation. For example, you will find general weakness, or you will find it in the case of anemic patients. In cancer patients, you will find them generally weakened. Okay, so starvation atrophy occurs in them. Next, ischemic atrophy. From the word itself, ischemic atrophy, where there will be a stoppage in the blood supply. Okay. Next, diffuse atrophy. After that comes neuropathic atrophy and endocrinic atrophy. Fine. So uh, in neuropathic atrophy, I don't remember the diffuse atrophy, I'm really sorry about it. In neuropathic atrophy, you will find once there is a lesion in the neuropathic path. For example, you will find it in poliomyelitis. Okay. And there will occur some wasting of muscles. Fine. In the same way, yes, diffuse atrophy. Diffuse atrophy also occurs in the limbs. For example, there will also be wasting of muscles in case once immobilization occurs. Okay. Next, endocrinoatrophy. There will be atrophy of endocrine organs. Fine. So that's the pathological causes of atrophy. Now let's come next. That is what is hypertrophy. So guys, the next one comes. The next cellular adaptation or the adaptation disorder is hypertrophy. What are those? What's hypertrophy? Hypertrophy is nothing but increase in the size of the parenchymal cells that leads to the enlargement of an organ, and causes are physiological and pathological. Okay, so what is the main thing happening here in hypertrophy? Increase in the size of parenchymal cells. Okay, due to which there will be an enlargement in the organs. Next, coming to the causes, the first physiological cause we can see enlargement of a pregnant uterus. Fine. In pregnant ladies, once they undergo pregnancies, the uterus are being enlarged because of the fetus. Next, we come to the pathological conditions. Fine. The first pathological condition you will see hypertrophy of cardiac muscle. Okay. What are the examples? Where it is where does this happen? Hypertension. Okay. Very common things. Next, you can say sometimes stenosis. Fine. Next, hypertrophy of smooth muscles, hypertrophy of skeletal muscles. In skeletal muscles, if you see those athletes, gym, bodybuilding, fine, and compensatory hypertrophy. This is very interesting. Compensatory hypertrophy is the type of hypertrophy that happens, for example, once an organ is being removed. For example, if in case of nephrectomy, one kidney is removed, the other kidney which is already present in the body that is functioning well, it is size, it is parenchymal cells, its size increases. Okay, so that's called as compensatory hypertrophy. Now let's come to next cellular adaptation disorder, and that is called as hyperplasia. So guys, hyperplasia. Okay, what's hyperplasia? It is increase in the number of parenchymal cells that leads to the enlargement of an organ. What happens here? This number of cells increases, the number of parenchymal cells increases. Please note this thing. These are very important point. It's a bit confusing, but it's very easy. I will tell it in the last in summary, in conclusion. Fine. So what will happen here? Increase in the number of parenchymal cells that leads to the enlargement of an organ. And causes, physiological causes. Physiological causes are here divided into two parts. The first one is hormonal hyperplasia and then compensatory hyperplasia. What is hormonal hyperplasia? Hormonal hyperplasia occurs once there is an hormonal stimulus, and compensatory hyperplasia occurs on the removal of a organ, or there occurs certain organ damage where the power of regeneration is being there. Fine, let me give you the examples. So once it comes to hormonal hyperplasia, the examples are enlargement of breast in females in puberty. Fine. Next, benign prostatic hyperplasia in elderly males or in old age. Fine, that is enlargement of prostate gland. Next, compensatory hyperplasia. Examples are regeneration of liver in case of certain, hepatic surgeries. A part of liver is being removed and it is being donated. Fine, for a donor. That time, regeneration of the liver is being there. That is the example of compensatory hyperplasia. Next, regeneration of epidermis in trauma or in case of abrasion, sudden fall, abrasion occurs in the skin, so the epidermis comes back. That is one of the examples of compensatory hyperplasia. Now let's come to the pathological causes. So guys, once it comes to the pathological causes, I'm sorry, it comes to the pathological causes. What happens there? Hormonal and growth or the growth factors exert their, uh, you know, uh, exerts there, and the examples are wound healing and fibrocystic changes in breast or fibrocystic changes of breast. Why wound healing? Because of the formation of granulation tissue, and fibrocystic breast stuff change. It's a very normal thing and it's a benign condition that occurs in breast. Okay, now let's come to metaplasia. So guys, coming to metaplasia. What is metaplasia? It is reversible change of one type of epithelium or mesenchymal cells. Fine, or you can say there occurs a reversible conversion of one epithelium to another epithelium, or of one mesenchymal cells to other type of mesenchymal cells. Now they are divided into two types, that is epithelial metaplasia and mesenchymal metaplasia. What are the examples in epithelial metaplasia? Is squamous metaplasia, columnar metaplasia, and in mesenchymal metaplasia is osseous metaplasia and cartilaginous metaplasia. Now let's come to the last one, and that is dysplasia. So, guys, coming to the last cellular adaptation or cellular disorder or adaptive, or adaptation disorder is dysplasia. So, what is dysplasia? It is nothing but disordered cellular development that is accompanied with metaplasia and hyperplasia. What is it? Disordered cellular development. It's a disorder in the development of cells or in the cellular development, which is accompanied with metaplasia and hyperplasia. So these two characters are very much visible. That is what is there. Metaplasia and hyperplasia are the two characters that are visible in dysplasia. And what are the characteristics of dysplasia? Okay, there will be loss of polarity, increased layer of epithelial cells, cellular pleomorphism, increased mitotic activity. Okay, and the best example is carcinoma in situ. Fine. Next, that's it for today. And now next I will give you a small summary of the entire thing. So guys, since you people should have no confusion, okay, I will just give at the end a summary. Atrophy is increase in number and sorry, decrease in number and size. Atrophy is decrease in number and size. Hypertrophy is increase in size. Fine. Hyperplasia is increase in number. Metaplasia is reversible conversion of one epithelium to other epithelium or any mesenchymal cell. Next, dysplasia is accompanied with metaplasia or hyperplasia. Fine. So this is the complete summary of cellular adaptations or adaptive disorders or adaptation disorders of cells. That's all for today. Stay subscribed to my channel Revise Pathology. Like, comment, and share my videos. And please subscribe to my channel Revise Pathology. And for further any details, you can even DM us on Insta account, that is revise underscore pathology. So guys, take care of yourselves and have a good life and stay healthy. Allah Hafiz.